Hello everybody, Suzanne Connors-Inc. from Dawning Visions Hypnosis and Reclaim Your Practice in Your Life. I don't know if some of you therapists out there question why it is that some of your patients never show up for their next appointments, and even more so why they're not willing to speak to you about what it is that was on their mind that stopped them from coming to see you any longer. And I can tell you this, I have some answers for you. And some of them may shock you. But being a person who has answered over 2,400 questions on Quora, I have a pretty good idea as to what's going on in therapy patients' minds. So let's get into it. The first one is that on too many occasions, they feel intimidated by you. Sometimes they are concerned about how you may be judging them in terms of the things that they need to talk to you about that they feel really ashamed of. And if they did talk to you about these things, sometimes they feel so badly they don't want to come back because they think you're going to judge them. And in some cases, it's absolutely true. Therapists do judge their patients. I know, because as a hypnotist, I have a lot of folks who come in to see me after they've been in therapy for weeks, months, years, and sometimes, sadly, decades with these complaints. Another thing that's truly problematic is the fact that many times, if a therapist has not cleared up their own issues, they're triggered by their own patients' problems. And this can come about in what you would feel as a really compassionate response, maybe to a divorcee whose life was turned upside down by her husband leaving her, maybe with a few kids to raise, now all of a sudden on her own. And the problem with this is that it's never about taking sides. There's many times when if you actually met their ex, you may have found out that it was actually your client that was the problem and not the ex. And I found that out when I had a blackout alcoholic contract me to help her, and she was raising mayhem every time she walked in the door after working in New York City and then traveling home to the suburbs in Connecticut, to be so drunk, so hostile toward everyone in that household that no one, most especially her 4 kids, wanted to deal with her. And yet she blamed her husband, who she was emasculating, by putting him down, most especially in front of his kids, who had lost respect for him as a result of that. So we need to stop jumping to conclusions and pretending that the stories that our clients, patients tell us is the truth, because sometimes it's not. Sometimes it is, sometimes it's not. But we have to be able to assess these things objectively. That's what we're paid to do. And there's another problem that occurs in telling patients what they're thinking or what they're feeling. There is no way in hell that we know what they're thinking or feeling. And if you've ever been married or have kids, you know how true that statement is. Because there are times when our spouses and our kids surprise us with their behavior, things that we never thought they were capable of doing, and all of a sudden we found out that they were doing these things. Spouses cheating, kids getting into trouble even though they deny endlessly that they did anything wrong. These things happen. So stop pretending that you're God and you know what's happening in your patients' minds, because you don't. And you don't have a right to tell them what they're thinking or feeling either. Because you and me would hate it if anyone had the guts to do that to us. Be honest about it. So please don't do that to your patients. They hate it, and they hate it with just cause. Another issue that comes up quite frequently is the fact that they know why they have the problem, but it's not been healed. They still have the same problems, be it obsessive compulsive behaviors that they cannot get out of the cycle of doing them, making them late for work or other things that they want to do activity-wise. People who are so depressed that they can't get out of bed, even with medications, which, by the way, have not been any more helpful than just having your patients exercise, seriously, or take fish oil supplements or eat oily, fatty fish. Better to have them do things that are not going to interfere with their ability to think clearly and create toxicity in their bodies over time, because we know all medications do that, because the livers and the kidneys, depending on where the drugs are being detoxified, are going to get to the point where they're not able to do it. And I actually had that problem in my own treatment when my kidneys started slowing down. And thank Godfully, I found out how to clear my own bipolar 2 with timeline therapy by Tad James himself, who developed timeline therapy. I just needed to know what negative emotions to clear, and he couldn't teach that in the training. It was outside of the scope of many of the people who are in that training. It's knowledge-based, so ethics, they matter. And then I would also have to say that a lot of times patients just get sick of dealing with people who have more problems than they do. There was a question I answered today on Quora. It's a forum where anyone can ask any question about anything and people answer them. And that was the question. Why are there so few really good therapists out there? And I answered it from the perspective of the patient looking for a competent therapist. And so I went through these very red flags. I'd also say that I had a client years ago who went to go see a therapist who was really overweight, busting out of her shirt, and the thought that she had was, if this person can't even keep their own weight under control and doesn't know how to dress appropriately for the position, why the hell would I trust her to help me? Good question. And the same client had another problem with another person who was a psychiatric social worker who inside of 5 minutes made a decision that this particular client was suicidal when the question was, have you ever been suicidal? Not, are you suicidal now? And went out and got some cops called over to take her to a mental hospital so she could be evaluated, which only took about 12 hours to be done. By the time she was done, it was 1 o'clock in the morning, and thank God she had $20 in her wallet to pay for a cab to get her back to the parking lot where the psychiatric social workers. The parking lot was where her car was parked. That when she made the decision to find someone who had a different modality of healing that could probably help her without sending the cops after her. Interestingly enough, the very last psychiatrist who evaluated her that evening told her to make lemonade out of lemons, because in his estimation, she wasn't suicidal at that moment and didn't need to have that drastic thing happen. But the psychiatric social worker was more, invested in protecting her license than doing effective work with this brand new patient of hers who walked out never to see this person again, rightfully so. So those are some of the reasons. Sure, if I sat here long enough, I could come up with more, but you get the idea. You need to get yourself to the point where you're healed well enough so that you are able to hear what it is that your patients are saying in the context in which it is meant to be heard. And you also need to understand that, there's different paradigms of healing. There's a difference between managing mental health problems and actually knowing how to heal them. And I'm here to tell you that if you wanted to learn how to integrate hypnosis and neurolinguistic programming, timeline therapy, in your practice, I'm here to help you learn how to do that. I offer VIP days. One, if you only want to learn how to do something like help people get rid of anxiety and all the anxiety-related issues, as happened with the psychiatrist who hired me to help him with a patient of his that was only his patient for 20 years, and inside of a session or two, he was able to help her to overcome these issues. And that was one day. Or if you're the type of person like one of my very happy clients, Dr. Sharon Mintz-Grossman, she did 2 days of VIP so that she could stop doing psychology and become the burnout coach. And she's doing amazingly well. I'm really proud of what she's been able to do with the work that we did, and she wanted to learn it all, so she did. And you can certainly let me know in the comments if that is something that you're interested in doing. I look at all my comments. I respond to all of them. And let me know, and we'll set up a time to get together and set that up for you. I'm also getting a group together to start in middle February for licensed psychologists, PhDs. Only 4 people are going to be in that program, and you're going to learn how to use all of these tools and techniques that are going to truly help you, along with a protocol for treatment that I've been using for the past, 17 years, quite successfully, with all kinds of people, with all kinds of problems that the conventional world say are impossible to heal, which I can tell you that my clients over 17, 18 years have proven that that is absolutely wrong. You just need to know how to work in their subconscious mind appropriately. And with mentorship attached. So if you're interested in that, again, in the comments, just let me know, because I would love all people who work in mental health, most especially, to learn how to use these tools and techniques in a way that is really helpful to helping your patients transform their lives. And trust me, you can charge a hell of a lot more doing it this way, because time is of the essence. These people are sick of being sick of being stuck, and they want to heal. And they're willing to pay. They're willing to pay out of pocket to do it in many cases. So you don't have to deal with insurance companies. How nice is that? So I trust that you got a lot out of this video. I thank you for spending your time with me. Till next time. Goodbye.